It's so hard when we read the news stories of people who have died by suicide, or even more so when I talk to people, especially parents who have lost a child. And there was a time just a few months ago when I went and spoke at a school that had a suicide there, and afterwards mom came up to me and showed me a picture of her 13-year-old daughter who had died by suicide.
Well, I have a very personal example of a student of mine who I guess would have been about 8 to 9 years ago took his life. He happened to be a training partner of mine. So when I was competing in the national championships in 1998 and 1999, he was one of my training partners and a really good friend.
The daughter had actually come to her and said, I am depressed, I need help. And like so many people, they tried to navigate the mental health system, and it's really hard to navigate. There aren't enough providers, there's long waiting lists, and so just because somebody wants help doesn't always mean that they can get it.
And I remember cutting the conversation short with him at that time.
They got an appointment for their daughter, but they had to wait 5 weeks, and she died after just 4 weeks.
I then went off on vacation the next day or two, called in to make sure things were well, and was told he had taken his life like that weekend. And I'm just wondering if I wouldn't have taken the time to just connect with him a little bit more that day, if something might have changed.
I keep a picture of her on my desk now, just as a reminder of what's at stake. Colorado has one of the highest suicide rates in the nation. Over 1,000 people die by suicide in Colorado every year. And if you think about the number of attempts, it's probably close to 12 or 13,000.
There's a lot that we know can be done for people, but the services just haven't been available for most people.
Here at the Depression Center, we are really trying to do a lot in the arena of stigma reduction and educating people.
And community programs and really community engagement.
These community programs are actually giving people tools to go into the community and be supportive and help people who are struggling and help people get the help that they need.
All the community programs that we deliver are delivered free of charge, and that's really important to us because we never want cost to be an impediment. We have done everything from doing suicide prevention work in people's homes, mental health education at a facility for aging adults, and then we have this partnership with Chris Natsky and his martial arts studios.
We've been doing some very different things with the way that we test our black belts.
You have to do equal parts physical as well as mental, emotional development.
They have to register 400 random acts of kindness.
So I did that for my first degree, and when I was going to get my second degree, I wanted to do something different. So I went to Master Natsky and asked him if I could get 40 people trained in suicide prevention. And he loved the idea, and so we got 42 people trained the first time.
And as soon as I went through the training, I said, we need to make this part of our program.
Every time that we do one of these suicide prevention trainings, more and more people come. And it's not just the students, but it's also their family members.
It's amazingly simple. It's a few key things to remember, and it's really about having the courage to ask and understanding that people aren't offended if you ask them how they're doing and if they're thinking of hurting themselves. 14
years ago, when I first started to really battle part of bipolar disorder, which I didn't know that I had, I was in this downward depressive spiral. Fortunately, I had people around me who recognized what was going on, who were able to talk with me and to steer me into care, and began what was a very long road towards getting better.
I guess about 6 months ago, this young girl, fantastic student, she and her mom had gone through the suicide prevention training. The young girl picked up her phone and handed it to her mom and showed her mom her detailed plans for her suicide. The bells and whistles went off as you'd have any parent go through that. And she went to the emergency room and got her daughter evaluated. And within a couple of hours, they evaluated her and put her into a program. So I got a phone call the day that they had admitted their daughter. Mom said to me, she said, Master Natsky, I want you to get this. She said, if you ever think for a moment that what you do doesn't make a difference, know that it does, because the suicide prevention training that I went through saved my daughter's life.
The people who go through the training and then can actually apply it, they're heroes.
Depression can strike anybody, anywhere. It doesn't matter your education, it doesn't matter your race, it doesn't matter your gender.
Suicide's one of the last taboos that we have in this country. If we don't do this work and if we don't engage other people in it, stigma will hang around, and stigma kills people.
But what we know is that once we start talking about it, once we start educating people, that really starts to change the way people view mental health.
We've started a movement that's going to continue to change things.
This program doesn't just enhance lives and doesn't just transform lives, it saves lives.
If you are able to say that we help save even one life, it makes it all worth it.